Welcome to another edition of Inside Town Hall. I'm Jim Cameron. Don't let the glasses fool you. I'm not joining a rock band. I just had some cataract surgery yesterday, so my usual glasses are not going to work. I have to wear these special glasses. But we're all talking about health today and human services. Our guest on the program is Ali Ramstek, who is the director of the Human Services Office at Town Hall. Welcome to Inside Town Hall.
Thank you, Jim, for having me. Pleasure to be here.
So let's talk a little bit about your background, and then we'll talk about the good works that you do in your office. You are an LCSW. What does that stand for?
So that's a licensed clinical social worker. So I received my master's degree in social work and clinical social work from Columbia, and then you have to pass a test, and then you have to have a certain amount of and then you become an LMSW, which is a licensed master social worker. And then you have to have supervision for 3,000 hours before you can apply again for the LC. So I'm done. That's it. So now I'm officially, clinical social worker, just have to do my CEUs indefinitely. No more tests.
Good for you. And how long have you worked for the town in human services?
So I've worked for the town for 10 years. It was 10 years in January. I started out as a part-time case manager, and Olive Hauser was the director then. And then slowly my hours increased, and then I became assistant director and so on. And then when Olive retired in 2017, I was promoted to her position as a director. So I've been here for 10 years, and I live in town. I've lived here for 19 years and have 3 daughters in the school system.
Excellent. And it used to be called the Social Services Department. Why the name change?
That happened since I've been here. It changed. I can't remember when. It's been quite a few years now. I think everyone assumed social services was like the Department of Social Services for the state. So that's called DSS. So we wanted to take away from it. So we don't just work with people who need financial assistance. We wanted to, kind of encompass all services that people might need. So they felt there was a kind of not negative connotation, but kind of not giving the whole picture of what we do. And actually many other towns have also locally have changed to human services from social services.
Because there is something of a stigma about saying social services, because what you do goes beyond people who may just have financial need as well, right?
Exactly. And that's what we wanted to encompass by changing the name of the department.
So I have a long list of the services you provide, and let's talk about some of those. Speaking of people who, may have financial needs, but may have other needs as well too, you have a medical supply closet. I, in full disclosure, have taken advantage of this to get a cane if I needed one to walk around while recovering from surgery. What's the idea behind the medical supply closet?
So that's open to any Darien resident. All of our services are open to Darien residents only, but any Darien resident. And a lot of times, like you for example, that you just temporarily need something. Like maybe you just had surgery and you just needed a walker temporarily, or you needed a transport chair while you're recuperating from something, or even having a loved one visit, like an elderly loved one who might need, to borrow a transport chair. And no one really wants to hang on to those things. People are always happy to get rid of them if you don't need them. So it's been going. When I began here 10 years ago, we already had it in place. So we have transport chairs, which are like lightweight wheelchairs. We have the heavy duty wheelchairs, but the transport chairs are the ones you put in and out of the car easily, like if you're going to doctor's appointments, walkers, canes, crutches. Occasionally we have things like commodes, but we only take those or shower chairs if they're new. We don't take used ones, but so that's a great resource, and a lot of residents take advantage of it. Free of charge.
Free of charge.
Mm-hmm.
So you could not only borrow that equipment, but you could also donate it if you happen to have it, right?
Absolutely. And then we rely heavily on those donations. Absolutely. So if people have, we won't only like gently used kinds of things, but absolutely, we get a lot of donations, and we're grateful for that.
And you also have a household supply closet. What's in there, and who's that intended to serve?
So that is what we call a home goods closet. And what that is, it's for our low-income residents or clients that the goal of this originally when it started was this is stuff that is not covered by food stamps. So people who are on food stamps, that strictly covers food. It doesn't cover deodorant, detergent, toilet paper, personal hygiene items, and all of those things can really add up. So our clients, once they've been vetted and are established clients, they come once a month so they can get those supplies, and it saves them money. We rely heavily on donations on that. Lots of the schools and Cub Scouts and various organizations have done drives for us, the depot. So that is I mean, we have clients who come literally every 30 days. They have it on their calendar. So it makes a tremendous difference to them when they're living paycheck to paycheck or month to month.
You also have a back to school program in the fall.
Yeah, so we just did that in August. So all of the clients that we are working with that are low income and have school age children, they are eligible to get a $50 Target gift card for each of their children. Prior to the pandemic, we used to actually have school supplies that they would come and pick them all up. And then once the pandemic hit, we transitioned that first summer to gift cards, and we had a little drive-through in the lower parking lot. And the clients were really, really receptive to this, because then they can buy whatever it is in particular that they want for their child. So we also, do send it out to everyone on the free and reduced lunch list from the schools. So some of those people are not our clients, but sometimes then we develop, have new clients come to us. So
And
very successful. The clients appreciate it. We had roughly 80 kids this year who received gift cards, and many people donate to us. The community fund also gave us some funding. The schools give us funding. Various PTOs, they do for quite a few years now. When they have their their school supply orders towards the end of the year, in like say June or May, they had a place where you could donate to Human Services. So the middle school and the elementary schools have been donating to us specifically for this, which is great. I'm so grateful.
And at holiday time, you also have a holiday program for people who want to make some donations to people of need.
Yeah. So again, things have transitioned a little over the years, but right now what we've been doing the last few years is we have what we call an adopt a family or adopt a senior program. So those families are families that, again, like that are vetted, that we work with, that are financially struggling. And we pair them up with people from the community who want to donate, and we give them a wish list. So the donor and the actual recipient never meet each other for confidentiality reasons. So our departments will go between and coordinating that. And roughly 50 families we had last year. I don't remember the number off the top of my head, but it's usually around 50. And then we also do it for seniors, and that they're not necessarily low income seniors. It could be seniors that we know are lonely or struggling, or maybe had a recent loss, that just to kind of brighten up their holidays. So it's well received by everyone. The people who donate love being a part of it, and we rely heavily on the community to do that. So we appreciate that as well.
Ali Ramstek is our guest today on Inside Town Hall. She is the director of the Human Services Department. You mentioned people of financial need, and I think when people think of Darien, they don't realize that there are people in financial need in town. How many people are there in that need group? Mm-hmm. And why are they in financial need living in such an affluent town?
Mm-hmm. Well, first of all, I think the priority for most of these families we work with is for the school system. They want to be here for the schools, and of course the great town and all we offer, but we hear it all the time from our clients, like they want to stay here until their children can graduate from high school. So last number I heard was roughly 4% of Darien. Now that's before 2020. I don't know when the next kind of survey information will come out, but about 4% of the town does live in poverty. And our clients are not just in the affordable housing units. There's people throughout every community. There's some people find cottages to rent, or they rent rooms, and so on and so forth. But certainly the established low-income housing, and even there's some low-income housing in Avalon or affordable housing. Many of those people are our clients and are eligible for our services.
And COVID certainly had an impact on many of those people. Mm-hmm. As well as the rest of us as well, too. And one of the things that I know that you discuss at the Human Services Committee meeting, and also at the Commission on Aging, which you sit on as well, is the problem of foreclosures. you have a renter's assistance program, but what's the situation now with people in town who have passed the moratorium on rent that came with COVID and are unable to pay? Are they literally losing their homes?
So the renters rebate program is something separate I can touch on after this. So yes, as you know, during COVID, there was a moratorium on evictions. So for over a year, no one was being evicted. And then that was lifted last summer, not this past, the summer of 2021. The courts were really backed up. So, since they were closed for a period of time there too for non-emergency issues. So there are foreclosures starting to happen. And when that happens, depending, if it's a mortgage on a substantial mortgage, we aren't necessarily able to help. But there's also evictions from renters, and we see more of that. And luckily, with the ARPA funds that we did have some designated to the Human Services Department for their essential needs, which we've been able to tap into. So some people who might have applied for Unite CT, which was a state program to help people with outstanding electric bills and rent due to COVID. That ended I think it was this past May or March. And a lot of the applications were kind of at a standstill, and some people didn't get those funds. But with those ARPA funds, we've been able to help people with their back rent. So we could help somebody if they have and they're living in affordable housing. So we've been able to help quite a few people so far, and I anticipate more in the near future. So that funding's been a tremendous resource. We've been able to prevent people from being evicted.
But there have been evictions in town?
Yes, there are. There have been. We had one, I think it was in July, and then one in April so far this year.
And what happens to those people?
It depends. Most of them are able to find, family or friends that they can go and live with. Occasionally, very rarely, only twice, I think, since I've been here for 10 years, have families had to go to a shelter. But the shelter's not the worst alternative because they have services and they're there to provide support. They have social workers and they can help with long-term planning and finding housing. But the majority of people, I would say, find someone else to live with.
You mentioned the renters rebate program, which is somewhat different. Tell us about that.
So that's a program, actually, Cynthia Hall is the one who runs it. She's the assistant director. By the way, there's just two social workers, myself and Cynthia, and then we have two program assistants, and then we share an office administrator with the health department. So Cynthia runs the renters rebate program, and that's a state program for anyone over 65 or who's on Social Security disability and has lived in Connecticut for a year and rents. So if they do, then they are eligible with showing proof of income for the previous year. So like right now, it's ending at the end of September, but it's for the year of 2021. So they have to provide documentation on income for the whole year, utilities, and rent. And if they qualify within the income brackets, they actually get a check in October from the state up to $700, which is great for our seniors and people with disabilities who are on a fixed income. And it usually comes right before the holidays. So it's a really great program.
And is there a reluctance among some people to take what they might think is a handout? I mean, they're definitely in need.
Mm-hmm.
Joe Pankowski of the Commission on Aging spoke about that challenge. Beth Paris, who runs the senior center, spoke of the challenge of encouraging people to come and take advantage of town services like this.
Mm-hmm.
How do people know about these services in the first place, let alone work up the courage to say, maybe I could get some help?
Right. There absolutely is resistance from a lot of people. I think especially because we're a small town and people are really conscious or self-conscious of others knowing that they're struggling. We try to periodically put out in the paper and the media about the services that we offer. Each seasonal one, we certainly do. We also often post in the school wires, like those weekly emails that the parents get. But when we do talk to someone who is coming to us for the first time and is often never been in this situation before, maybe one of the parents lost their job and they're really struggling, we will accommodate them. We can tell them they can come in the back entrance. No one has to see them coming in. They could be coming in, like I said, we're in a suite with the health department. So everything we do is confidential, and we try to make people as comfortable as possible. But if necessary, we can do things over the phone and email, so if people need to receive services, we'll try to accommodate them however we can, because it is hard for people to ask help, but especially in a town where the majority of people are comfortable or affluent.
Do you work with agencies like Person to Person, which provide similar services?
Yep, absolutely. So Person to Person is the food pantry that our residents can use. So they can go there once a month and get food. So many of our clients do that and take advantage of that. So yes, we work closely with them and various local social service and mental health agencies as well, providers. We also work closely with the schools and school social workers and psychologists, guidance counselors, as well as the Darien Police Department. They often will refer people to us if they feel might need some services from us. So try to collaborate with various departments in town, kind of be a safety net.
Ali Ramstek, our guest today on Inside Town Hall. And again, I apologize for the glasses. These are post-operative glasses, so I'm not joining a rock band or anything like that. You also sit not only on the Commission on Aging, but also on the Blight Review Board. I'm sorry, is that the right phrase? The Blight Review Board?
The Blight Review Board.
Blight Review Board, which helps people who may be facing mental health problems or financial problems. They can't keep up their homes. They can't keep up their yards. What do you do on the Blight Review Board, and what kind of clients have you been able to help?
Okay. So the way it works with the Blight Review Board, the Blight Prevention Officer, Bob Solito, if he gets, notified of a complaint, he will review with me particularly if it's an elderly person that they know is a senior, or just run it by me in case it's someone that we already work with. And of course, I don't acknowledge that to anyone, it's all confidential, but we will reach out to the person and see if we can be of help. So we've helped people with paying for their yard cleanup if necessary, if that was one of the things. We also have helped people with dumpsters when they need to clear out a lot of stuff. So those are the biggest financial ways that we've helped, but also a few people that we've supported just along the way, because it can be very upsetting for people to get these complaints. Now, sometimes there are situations where the person might have an issue with hoarding, which is a mental health disorder, and that's more of a chronic problem. And someone who has to be willing to get help. So we try to be supportive in whatever way we can, but particularly if it's a senior or someone who needs financial assistance, or if there's a hoarding situation.
The Veterans Tax Exemption Program, that's one I was reading about that I was not aware of. What's involved with that?
That's actually through the assessor's office. So based on your income, if you're a veteran, you can get a tax cut, a tax break every year. So we will advertise it or remind our seniors or at the Commission on Aging, so that we get the word out. We're not running that program, but we work closely with the assessor's office, and we'll help our seniors, especially if there's homebound ones. We'll help them get the paperwork necessary or signatures and whatnot, so that they can get that benefit. And not just for veterans, there's also another, which I'm sure you're aware of, like tax breaks based on income.
Right. We're recording this in late September, and we're I guess looking forward to slightly cooler temperatures, but winter is coming.
Mm-hmm.
And with winter, given the price of gasoline and heating oil, there's a real concern among many people about, are they going to be able to afford to keep their homes warm? You have an energy assistance program in your office as well.
Yep, we do. So that's actually a state-run program, but we process the application, or we gather the applications and send them to the agency that works for DSS to process it. But basically, this is for any low-income resident. There's guidelines that are on our website, or should be on our website if it's not up yet. And the goal of this is to help them with their home heating bills for the winter season. It doesn't cover all of the bills necessarily, and it doesn't cover back bills. But the good thing about this is the last couple of years, because of COVID, there used to be an asset limit. It was $15,000 for a homeowner. and 12,000 for a renter, and they've waived that, which has been tremendous, particularly for our seniors who are on fixed income but might have some savings or IRAs. So quite a few new people were able to apply in the last few years. And this was a tremendous help. It can cover, it's based on your household size and your income, how much coverage you get. But one of our seniors, I was actually doing a home visit yesterday to help gather her documents with her, and it covered all of her heating for the last season. Now, obviously, the prices are even higher now, so we'll see what this season brings. But I anticipate, because of all the high prices, that we'll probably get quite a few more new clients. And we did advertise it. Marley Hayes had shared, with the local media and whatnot about this program. And the people who've been on the program in the past, or the past 2 years, some people might miss a year or something, we send a letter to all of them reminding them about this, so that they're eligible. And then we also, about halfway through the year, if they haven't applied, we'll remind them, send out another reminder letter to remind people to do this. So we start with our oil clients, because those residents who heat with oil, they can start getting deliveries on November 1st. So right now we're prioritizing them, so they're ready to go. So come November, they can start requesting deliveries. And then we, our utility heated homes like electric, propane, and gas, we start in October, and they get a lump sum grant to their actual bill, as opposed to the oil. They can get repeated deliveries, depending on, again, their income and household size.
And again, we were mentioning earlier the social stigma or the reluctance of some people to ask for help. And I'm just wondering, what's the role of a neighbor who sees somebody elderly or maybe not of financial means, who they know is a neighbor? And I mean, we kind of look in on them after a blizzard or something, maybe check and see how they're doing, but it's hard to know whether their houses are warm in
Right.
the winter. How do you, if you're a neighbor and you're concerned and you want to help out a neighbor, how do you make that kind of an overture? How do you start that conversation?
I have to say, Darien has really good neighbors. We have so many people who care about their neighbors and look out, and we get phone calls from people who are concerned about individuals. And certainly people can call us. They can call us anonymously, and we will reach out to anybody. And if it's, we also do home visits, particularly for the seniors. So if someone is concerned, they can certainly call our office, and we will reach out to that individual. And it can be confidential, absolutely. So certainly we'll do whatever outreach we can to help someone if they're in need.
Allie Ramstack, our guest today, she is the director of the Human Services Office at Darien Town Hall. That's what this program is. It's called Inside Town Hall, and we're talking about the good works of her office. In the minutes we have left, I want to spend a little time talking about mental health, because you unfortunately had to take a leadership role this spring when we had 2 suicides of students at Darien High School. How did the town react, and what is the Human Services Office doing to help?
Yes, as you know, our entire town suffered from, multiple tragedies in the springtime. 2 students from the high school died by suicide, and there was another adult who died by suicide, and then there was an untimely death of another high school student. And what we did was go into immediate action, working with the schools. So when the first death by suicide happened, we collaborated with Dr. Adley and various members of the school system to coordinate available office hours for anyone who was grieving or wanted to talk about what's happening and if they're having a hard time. So we kind of piggybacked with the high school on that first weekend that we were available on the weekend for anyone to come in and ask for help. We also then established, one thing we hear a lot is that it's really hard for people to get appointments. There's wait lists, and it's really hard to get access to mental health or to know even where to begin. So we have on the town website, right on the front page, it says mental health resources. And if people click on that, we have a list of providers that I personally personally checked in that they are taking new clients. So some take insurance, some don't. And that's something we're going to keep doing indefinitely. because we've had a lot of feedback that it's been really helpful. So periodically I'll check with them. I did probably about a month ago to make sure that those people were on there. So we'll add people to it, or we'll take them off if they say, no, we're full right now. And then after the second death by suicide of a student, the town came together and created a mental health task force. And this was in collaboration with about 45 people at this point, but it was the schools, the police, the first selectman's office, my department, the health department. I'm going to probably leave people out, clergy, and then various mental health providers in our agencies. So particularly Family Center, Center for Hope, Child Guidance Center, and Kids in Crisis, as well as Silver Hill Hospital, all collaborated. I mean, those agencies were on site at the high school, available to staff and to students. So we formed this task force so that we could all, be on the same page and work together cohesively. We managed things okay in the spring, but I think this really made us, the goal of this is to really focus on how we, God forbid something like this should happen again, how will we address it as a community? So we were actually advised by all the experts. So, and also the hub, I forgot to mention them. They were also essential to helping us. They're the what's the technical term? It's the regional mental health board for this area. So they actually, we suggested that we have a smaller group from the 45. That's a large working group, a large group to get work accomplished in. So we had a group of about 15 people. Oh, also Lawrence Funeral Home is involved as well. And we were trained in what they call post-vention suicide plan training. So we came up with a townwide plan of what exactly we would do, the order of events, and how we would proceed from there. So that was a 2-day training, 4 hours each day. So we did finish that. And then their recommendations were for the community. And this also, the American Foundation for Suicide Prevention is involved in there as well. And anyone I'm leaving out, I apologize. There's just so many organizations off the top of my head, I can't remember, but just an enormous outpouring of people who want to help. The Depot, the Community Fund, YWCA, YMCA. So they had told us, the experts told us that in the first 6 months following a death by suicide, their recommendations are not to do aggressive programming or education. It's more about support and resources. So we followed their guidance, even though at first many of us on this task force wanted to, we're rattling off all kinds of things that we wanted to do. And they said, no, it's not recommended. So we took their advice.
It's a time of bereavement still.
Exactly. Right? It's too acute, it's too fresh, it's too raw, and also in sensitivity to the families and loved ones and people who are familiar with the, people who died in untimely death. So we actually, even though it's called a post-vention suicide training, we're changing our plan to call an untimely death support team, because obviously, like the other young death, it was equally upsetting. I shouldn't say equally, but it was also upsetting. So now they have given us the green light to start doing some programming. So we've broken up into subcommittees and different kinds of groups. So we have the Behavioral Health and Programming Committee. And that is obviously what it sounds like. It's about what kind of programming can we do for the community. And we just met for the first time last week. And we've already come up with some ideas. One is going to be on October, and we're going to be sharing this information soon publicly via social media and the town posts and all of that. October 22nd is called the Out of the Darkness Walk. It's from the American Foundation for Suicide Prevention. And this is an opportunity for people they can raise money for the fund if they want to, or they can just join together and walk in honor of people and who have died by suicide, or just to educate people and to offer support, and as a way to bring the community together. So that's the first thing that we're going to be promoting. And then on November 19th, again, the American Foundation for Suicide Prevention has what they call a Survivor Day, and this is something that's nationwide. And they plan, and the Presbyterian Church offered to gladly host this. So it's going to be a day where people can come if interested, if they've been affected, or even if they haven't been directly affected, and it's going to be a workshop. And that's supposed to be well received by people who've attended it as well. And then, were you gonna ask something?
No, I was going to say these workshops are to help people recognize people who are in mental health needs, and not to necessarily try to counsel them, but to send them to the professionals who have those resources.
Yeah, so there will be professional clinicians present, I should say, at the actual event, but it's more about educating and it's about supporting, and it could be about reminiscing. If someone, there's going to be different groups. I don't know all the details quite yet. We're just in the American Foundation for Suicide Prevention has a whole program that they set up. But it's really open to anyone who wants to, could be someone who was affected, or it could just be someone who wants to educate themselves or be part of, this talking and hopefully prevention.
Excellent. Mental health is an issue that goes beyond the issue of suicide and bereavement of those we know who have taken their own lives. I mean, COVID has taken a tremendous toll on people's mental health. How do we know if we're having problems with the health of our mentality?
Mm-hmm.
What are the kind of warning signs that we should look for, either in ourselves or our loved ones?
Mm-hmm. Well, I think any change in behavior, if someone is suddenly more withdrawn or not performing or participating in activities that they used to, if there's a sleep disturbance, not just a normal that you wake up in the middle of the night, but really having sleeping issues or eating issues. Certainly, if someone ever discusses or mentions the idea of not wanting to be alive, you should take that seriously. There's now actually a new nationwide phone number similar to 911 that you would call for a medical emergency. It's called 988, and it's a national number that will be answered 24/7 by a clinician. And Connecticut has rolled it out. Some of the states, I think, we're still working out some details, last I heard, but it is available. And it's not just for someone who's having suicidal ideation, but even if someone's having mental health issues and want to talk to a professional. So that's a huge step for our entire nation. And in terms of the mental health, one other thing I wanted to kind of backtrack in terms of the task force, another subcommittee that we have formed is going to be a mental health assessment for the town of Darien. And we are actually in the very beginning stages of that also. How to actually do that, we'll probably have to use an outside agency that does surveys and whatnot and contract out, but that is something, and that's not just for school age. We want to do that from birth to seniors. So trying to get a sense of what the needs are and how people are feeling in the town. And then from there, we can decide what kind of programming and resources we can make available. So that's another aspect of the task force.
Allie Ramstack, the director of the Human Services Department at Darien Town Hall, your plate is awfully full.
Mm-hmm.
You offer a number of different services, and I hope this program has helped educate our viewers as to the depth of resources that you offer. How can people get in touch with your office if they have questions or they want more information? And as you say, it's all done anonymously or very discreetly.
100%. That's our number one priority, is keeping confidentiality so that people can reach out and feel comfortable. They can call our office directly at 656-7328, or you can email me directly, Ramsteck, RAMSTECK @DarienCT.gov.
We will put that email address right below on the screen, which you're looking at right now, so you'll know how to get in touch with Allie. Allie, thank you very much for being on the program.
Thank you for having me.
Very much for all the work that you do on behalf of the town and Human Services as well.
Thank you, Jim. Thanks for having me. Please
And
don't hesitate to reach out if anyone has any questions.
I'll make sure they do.
Thank you.
And thank you, our viewers, for watching, yes, another edition of Inside Town Hall.